Hello parents, good evening. This is Dr. Lalit Mittal from Giggles Clinics and my own space. So today's topic which we have chosen is about the probiotics versus prebiotics in modulating the gut microbiota in ASD. Now we know that in ASD, one of the most common causes and one of the most important factor is gut dysbiosis. So in today's presentation and webinar, we will see how the probiotics versus prebiotics, which one is beneficial or the combination is beneficial. So at the end of this webinar, we will be able to identify and we will be able to come to a conclusion that whether we should use probiotics alone, whether we should use prebiotics alone, or we should use them in combination with probiotics and prebiotics, and which prebiotics or probiotics to be used. So a brief about, so what are probiotics? Now, probiotics is the term which comes from the Latin word. Now, probiotics are defined as live microorganisms that when administered in adequate amounts conferred health benefit to the host. So the most important thing we should remember is they should be administered in adequate amounts to confer health benefit. And they are considered as live microorganisms. So as per the WHO, they mentioned that these are the live microorganisms and when administered in adequate amounts. So the important thing is that these live microorganisms or probiotics have to be administered in adequate amounts. Just taking probiotics is not beneficial. The amount, the dosage, and in which quantity we are giving the probiotics is very, very important to confer the actual adequate amount of health benefit to the host. So the most of the commercial probiotics which are available, we know that they are made up of either bifidobacterium strain, lactobacilli strain, and less commonly they are made up of bacillus. But the most common ones are bifidobacterium and lactobacilli. Now, from our point of view, for ASD spectrum point of view, bifidobacterium and lactobacilli strains are the most important ones because they confer a very good gut, eubiosis in children who are on the spectrum. So these are the most studied probiotics which are we have known in ASD. Now the most important thing is, if you see in this chart, the most studied probiotics are of the bifidobacterium strains and lactobacilli. So bifidobacterium bifidus, animalus, longus, brevis, infantilis. So these are some of the most common strains which have been found to be studied in ASD kids. Now the important thing is no single strain of probiotic is found to be effective in ASD. So as a result, whenever we are prescribing a probiotic in children who are on the spectrum, the most important thing is to remember that they should be containing different strains of bifidobacterium. Now, there are around 10 to 11 strains of bifidobacterium, which I have not mentioned in this, but those strains as much as possible should be present. The take-home message is it should not be a single strain of probiotic. So how these probiotics basically help? Now, it's a very simple mechanism. Basically, probiotics we are giving as live microorganisms. So when we are giving a probiotic to a child on the spectrum with severe gut dysbiosis, we will be giving a probiotic which is containing 7 to 8 different strains of bifidobacteriums, which are found to be effective in ASD. So when we give a probiotic that is live microorganisms, they will just go and increase in number. And the important thing, these probiotics basically, this is the mucous membrane, they bind to them like this. So as a result, there is no space available for the bad bacteria which are already present in the gut to bind to the mucosa. So these, as a result, when we give large amount of probiotics, they increase in number, bind to this mucosa, and no space is available for the bad bacteria to bind. As a result, mucus binding, as a result, what happens? The mucosa is better, the leaky gut chances are better. And also they don't give space for the bad bacteria to bind to the membrane of the lumen and as a result to grow in number. So this is one of the simple mechanism of probiotic. That means we are giving good bacteria to the body and so they increase in number. Now, what are the different varieties of probiotics? Now, these are the different varieties of probiotics and which have been studied specifically for lactobacilli and bifidobacterium. Now, this is a very simple diagram which I have prepared, which mentions you about the different features of the probiotics. Now, these probiotics, for example, lactobacilli, they have a specialized membrane which binds to the lining of the mucosa, that is the intestine. So as a result, they prevent the attachment of the bad bacteria. Also, they release some amount of different types of antimicrobials which prevent the growth of bad bacteria. Also, important thing is that by all these mechanisms, they also produce some anti-inflammatory. Anti-inflammatory means which prevent the chances of allergic reactions. So they help in immunomodulation. help in improving the immunity or maturing the immunity in a better state. So overall, the probiotics, especially of lactobacillus and bifidobacterium, they help in improvement of gut microbiota, they help in leaky gut issues, they also help in immunomodulation. Now, so these are the degrees or different degrees of development of gut dysbiosis. Now, we know that in a first diagram, which I have shown above, which is mentioned as normal, it is clearly mentioned it is mostly predominantly consisting of bifidobacteria and lactobacilli. Now, the green ones are the bifidobacteria, the blue ones are the lactobacilli. So this is the normal gut, which should be present in a child, whereas it is not present in a child who is on the spectrum. This diversity of U diversity shifts to the gut dysbiosis. So this diversity can vary from the degree of gut dysbiosis which is happening. If you see, if you carefully observe from circle 1 to circle 4, in circle 4 or the chart 4, the number of bifidobacteria and lactobacilli drastically reduces, whereas the number of other bacteria like enterococci or clostridia, which are bad bacteria, or Yersinia or yeast, they increase in numbers. So as a result, the degree of gut dysbiosis may vary from person to person. And we know that gut dysbiosis has been strongly associated with ASD and through the gut-brain axis. So the gut-brain axis, we have studied a lot about that. Alternation in the gut-brain axis results in alteration in the gut dysbiosis. That means a shift from good bacteria to the bad bacteria. As a result of this, the production of short-chain fatty acids like butyric acid and acid, which are very important for the functioning and help in maintaining the gut-brain axis. So these SCFAs are produced in majority amount by the good bacteria. So if they decrease in number, SCFA amounts, that is short chain fatty acids, also reduces and can alter the gut-brain axis and can cause gut dysbiosis. So the important thing to remember is that for a gut to be in a healthy state, the amount of bifidobacteria should be in a high number. That means the beneficial bacteria should be very, very high. Now, when we talk about, I have told you that in ASD kid, there is not a single strain of probiotic or bifidobacterium which is effective. That means you have to give a probiotic which is containing different strains of bifidobacterium when we are talking or dealing with children who are on the spectrum. But what is the problem with this administration? Multi-strain probiotics, they need to give along with a probiotic for the live bacteria to survive. Now, what is a prebiotic? We know that prebiotic is a feeding material. That means it acts as a feed for the bacteria to grow. So when we are giving a multi-strain probiotic, so suppose we are giving a multi-strain probiotic. For example, I'm using a multi-strain probiotic which containing different strains of bifidobacteria. So I have to add a small amount of prebiotic also so that those bacteria remain in a viable or live state. When we are giving a single strain probiotic, that amount of prebiotic is generally not required. But when a multi-strain probiotics are there, you need to provide some amount of prebiotics. So means to say, whenever any probiotic containing multi-strains of bifidobacteria are available in a market, they are always supplied with a prebiotic so that those bacteria remain survive in that environment. So now what are those? So now what are the different types of prebiotics which are available? Now the different types of prebiotics which we can choose, it can be either inulin, it can be GOS, that is galacto-oligosaccharides, or it can be FOS, fructo-oligosaccharides, or it can be HMO, that is human milk oligosaccharides. Now, till now, we have known about inulin, we know about GOS, we know about FOS. But HMO, what is this HMO? This is something new, which I'll be talking much about this. It is a prebiotic and it is much, much superior and much better compared to inulin, GOS, and FOS. How it is useful, we'll be dealing in next slides. Now, what are the different types of prebiotics which are available? As I've told you, we know about GOS, we know about FOS, we know about this HMO. Now, GOS or inulin. Now, GOS, FOS, both all these saccharides, they are not. These are basically plant-based saccharides, and these are basically derived from, like inulin, for example, it is derived from chicory, or you can say plant sources. So these are some of the different types of generally available probiotics, and these GOS and FOS are supposed to act as a prebiotic and help in promoting the growth of beneficial gut bacteria, but that is actually not true. The difference between the HMO and inulin, GOS, and FOS is HMO is a prebiotic which helps in increasing the growth of only selectively good bacteria like bifidobacterium's different strains, whereas inulin, GOS, and FOS, they help in increasing the growth of both good bacteria and bad bacteria. So the major difference is HMO specifically increase the growth of good bacteria, whereas inulin, GOS, and FOS can increase the growth of both good and bad bacteria. Why that difference is there and how it can be useful in our practical knowledge, we can see in future slides. So these are the different types of GAUS, FOS, and prebiotics which we know. So GAUS and FOS are prebiotics which supposed to increase the growth of beneficial gut bacteria, but they also increase the growth of bad bacteria. Now, first of all, just a bit about what are prebiotics. Prebiotics, we know that these are feeding materials and they act as a feed for the bacteria to grow. Whether it is a good bacteria, whether it is a bad bacteria, we cannot differentiate. The food cannot differentiate. You keep a food there. If you won't eat, another, animal or a dog will come and eat the food. So you cannot differentiate that. So that's the same thing for a prebiotic. So we know that different types of prebiotics like GAUS, FOS, and chicory or inulin. And but another prebiotic which is there, which is present naturally in the human milk, or I would say it is present in the breast milk or the mother's milk, and that is known as HMO, human milk oligosaccharide. They are naturally present in the human milk, but till now we had not discussed about this. This is one of the unique prebiotics compared to rest of those prebiotics, which we all know is that specifically increase the growth of beneficial or the good bacteria. So imagine how will be useful if we give a HMO acts as a prebiotic which helps in the growth of only beneficial bacteria, and that is the main problem in children who are on the spectrum with gut issues. So now what is the problem with prebiotics? Now when we give prebiotics like inulin, GAUS, FOS, which we all know, when they're administered, they act as a feed. So they will help in increasing the growth of both beneficial and bad bacteria. Why? What happens when you give a prebiotic into the body? It means they're in the gut. Now, in the gut, we know that all good and bad bacteria remain in an harmony. When that disturbance happens, the good bacteria goes down, bad bacteria goes up, gut dysbiosis happens. How does that happen? When you give a prebiotic like inulin, GAUS, and FOS, it goes there, remain undigested. The bad and good bacteria, they have a competition. Sometimes the bad bacteria will take more feed, they will increase in number. Sometimes good bacteria will take more feed, they will increase in number. As a result, there will be a process of waxing and waning. And as a result, you will observe that in your kids also that those children who are having symptoms of constipation, diarrhea, bloating issues, that time the sensory issues will shoot up. And sometimes when the bloating issues, constipation, gut issues are settled, sensory issues come down. Because when the issues are high, that means the inulin has been, or the prebiotic has been taken more by the bad bacteria. And when the gut issues are settled, that means that it has been taken more by the beneficial bacteria. So that is the problem when we give a prebiotics like GAUS, FOS, and inulin. So there is a waxing and waning of symptoms in children who are taking inulin GAUS. But this is not the case with HMO. As I have told, it's a prebiotic which selectively increases the growth of good bacteria. Now, so what makes this HMO so unique? Why is that it only increases the growth of bifidobacteria and not other bacteria like yeast? So human milk oligosaccharides, HMO are called human milk oligosaccharides, and they are a group of structurally complex unconjugated glycans that are highly abundant in human milk. Now, HMOs are basically undigested carbohydrates which reach our gut and remain there in the colon or in the large gut, where they shape the microbiota by acting as prebiotics. And there are different types of prebiotics which are present in the human milk, and the two most studied ones are 2FL and LNT. Now, these 2FL and LNT have now been commercially being used as a prebiotic in improving the gut microbiota in children who are on the spectrum. So a bit about, because I have told you that these HMOs, they are present in the human milk. So we should know a bit about the human milk or the breast milk. Now, the human milk or the mother milk contain different type of components like macro, micronutrients, water, and etc. Majority of it is made up of water. Remaining are micro and macro. Now, among these, we have different components. It has proteins like casein. It has a carbohydrate component like lactose and even glucose. Then it also contains lactose. It also contains HMOs, and it also contains lipids, fat component. So if you see that HMOs form 5 to 15 grams per liter of, when per liter of human milk contains 5 to 15 grams of HMOs. And other than this, there are other things like lactose, lipids, fats, protein, casein, etc. Now, if you divide these HMOs, there are more than 150 different types of HMOs which are present in the human milk. But for us, and which are found to be very, very useful, are the two ones like 2FL and LNT. So imagine if we can take out these HMOs from the human milk and without taking any other proteins like casein or lactose, because casein lactose is also a problem. because in children who are on the spectrum, they have lactose or maybe casein intolerance. So if you are extracting HMO from the human milk, we have to be very sure that it doesn't contain lactose, it doesn't contain casein. So that is the advancement which has been made in the field of spectrums and in the field of this, in extracting these HMOs without having any component of lactose or casein. So now a bit about HMO versus HMO, which are human milk oligosaccharides in comparison to human milk and cow milk. Now, if you see in the human milk on the left side, that is a mother's milk, oligosaccharides are present in oligosaccharides which are there. They are present in good quantity. They are present in 5 to 15 grams per liter of milk. Whereas if you see in case of cow milk, they are present hardly in 0.05 grams, and other components are there. So the thing is, the composition of the cow's milk and mother's milk, they contain all different components. They contain lactose, proteins, lipid, fat, oligosaccharides, HMOs. But the concentration of HMOs is very, very less in cow milk. So how we can make the use of these HMOs in our practice and how we can extract it. Now, the problem is taking HMOs from human milk is practically not possible. So what they have done, they have extracted this HMOs, a prebiotic, from cow milk. But the cow milk contains very less amount of oligosaccharides or HMOs. So now here comes the role of biotechnology and enzymatic processes by big companies which have taken a lot of initiatives, and now it has been, the HMOs have now been extracted from the cow milk and they have made them increased in number without containing lactose, without containing glucose, without containing casein. So why that difference is there between the HMOs, GAUs and FOS? Why HMOs promote the growth of beneficial? Why is not that GAUs and FOS don't promote? They promote the growth of both good and bad. So the basic is the basic difference lies because of the natural structure which has been given to them, to GAUs and HMOs. Now GAUs and FOS, if you see on this upper diagram, they have a linear structure, means a single straight line. Both, whereas HMOs, they have a hexagonal structure or they have a three-dimensional structure. So because of this three-dimensional structure, maybe something like that, they have the ability to bind to the good. Now what happens, suppose this is a prebiotic. Suppose this is a prebiotic which I am giving and I put it in the body. We know that in our gut we have good and bad bacteria. So when I give this prebiotic, so assuming that this is a prebiotic like HMO, and I give, and there are good bacteria in a body, so it binds to them. So they have a good interlocking. This is a prebiotic which in the form of HMO I give, and these are good bacteria which are present in the body. So by God's nature, they have a connection. They have a good receptors binding between the good and the bad bacteria. So these HMOs, they have a receptors which form an interlocking with bifidobacteria, which are good bacteria. So as a result, they bind to it and they take lot of feed from these prebiotics, because prebiotics act as a feed for the bacteria to grow. Whereas these HMOs, they don't form an interlocking with bad bacteria. Now, suppose this is a bad bacteria which doesn't have an interlocking. So how it will bind to it? There will be no connection. It will just slip it out. So when there is no binding between the two, so how you will feed on this bacteria? As a result, it specifically increases the growth of good bacteria. Now this is possible because of the structure of these HMOs. Now when you give inulin or FOS and GAUs, they don't have these interlocking type structures. So when you give this prebiotic, suppose this is an inulin, it is in like this, it's a linear structure. So when you give FOS, GAUs, it just goes into the body like this, settles down. So there doesn't have to be form an interlocking. So either a good or a bad bacteria can easily come here and engulf the food or take the food and increase in number. So sometimes good bacteria might increase, sometimes bad bacteria might increase. But HMOs, they have a typical interlocking system which only helps in binding with the good bacteria. So this is a typical thing or peculiarity with these HMOs which acts as a prebiotic. Now, these are the different studies which I have taken because we need to have an evidence why these HMOs, are there any clinical trials which have been done with these HMOs in comparison to inulin and GAUs? So they have done these studies, and where they found, as I have told you, remember, HMOs, the two most studies ones are LNT and 2FL. So what they found, these HMOs like LNT, they specifically promote the growth of strains of beneficial bacteria like Bifidobacterium, Bruvis, Bifidobacterium infantilis. So in this pie chart, what they did, they gave in the study population, they gave HMOs like LNT to the studied population, and in the pie chart they found that after giving for 2 to 3 months or a certain period of time, the amount of bifidobacteria strains were increased in number. So in this pie chart, the majority, 80% of this chart is covered by bifidobacteria strains. So this study clearly demonstrated, this was an observational study which clearly demonstrated that administration of these HMOs like LNT to the studied population, the amount of bifidobacteria strains selectively increased in number. Now, this is another study. This is another study to compare between the FOS, that is fructooligosaccharides, and HMO and SCFA production. I have told you SCFAs are short chain fatty acid which need to be produced by good bacteria in order to maintain a healthy gut-brain axis. So what they found in this study, again, they found that when FOS was given, when FOS and HMOs were given to the study population, the amount of SCFAs which were produced when HMO was given as a prebiotic, the studied population was much higher compared to those when FOS was given as a prebiotic to the studied population. Now, another study was done where they did the comparison again between FOS or GOS on bifidobacteria strains in comparison to HMO. So what they found, now these coded color, these are the bar charts. The blue ones are the bifidobacterium strains and the brown ones are the Clostridium, that means the bad bacteria. So what they found, when these HMOs were administered to the study population, the amount of bifidobacteria strains selectively very increased in number. Whereas when you give FOS, the amount of bifidobacterium strain did not increase in number, although they increased in number, but along with that, the Clostridium, the bad bacteria, which are marked in bar chart of brown color, they also increased in number. So whereas in case of HMOs, they did not increase at that significant level at all. It was predominantly the good bacteria. So this study also demonstrated that on administration of HMOs like 2FL and LT, they specifically increase the growth of good bacteria. Now, this is the diagram. This is a very complex diagram. This diagram I have shown you why HMOs are unique in binding and increasing the growth of bifidobacteria strains specifically and not the bad bacteria. It is because of these presence of these red receptors, which I have shown you as a formation of interlocking. Now, because of this interlocking formation, which I have told you, the good bacteria like bifidobacteria increase in number abundantly when given an HMO as a prebiotic in comparison to those when we give inulin or HFOS or GOS. So if you see in this diagram, different strains of bifidobacterium like longus, infantilis, vividum, bruvi, which are all have been studied, extensively and found to be very beneficial in kids who are on the spectrum. And also it has been found that these strains of bifidobacteria are found to be very much deficient in children who are on the spectrum with gut dysbiosis. So as a result, giving an HMO as a prebiotic could be proved to be quite beneficial in children who are on the spectrum with gut dysbiosis. So this is a diagram that HMOs also help in increasing the strains of bifidobacteria. The diagram is similar. It's the different mechanisms how they have shown, but the main concept is of formation of interlocking. They have these receptors which help in binding and interlocking with the good bacteria. So again, that HMOs are unique in promoting the growth of bifidobacterium strains only. Also, they help in formation of the membrane, prevention of leaky gut, because they have receptors, they bind to the mucous membrane and prevent the formation of the leaky gut or damage to the mucosa. And also because there is no space on the mucus or the membrane or the intestine or the gut, the bad bacteria cannot come here and bind. So as a result, the chances of yeast issues, the chances of leaky gut can also be improved a bit. And this was another diagram to confirm that HMOs specifically don't increase. Now, till now, I have shown you that HMOs have shown in studies to increase the growth of selectively good bacteria. But in this study, what they found that HMOs are unique in promoting the growth of, inhibiting the growth of harmful bacteria. They administered HMOs like 2FLNT to the study population. What they found, it was increased in number, the bad good bacteria. Then they stopped giving these HMOs for a certain period. They found that the levels of good bacteria decreased in number. Then they again administered 2FL and HMOs again after a certain period. Found what they found, the numbers of bifidobacteria again increased in number. So this clearly demonstrated that these prebiotics like HMOs specifically increase the growth of good bacteria, whereas they don't affect the growth of bad bacteria at all. In short, they inhibit the growth or don't increase the number of good bacteria or bad bacteria. So now till now I have talked to you about the gut. Now these HMOs are also unique in promoting the brain development. Now they help in the formation of synaptogenesis. In diagram left side, you can see those who have not been administered HMO, the brain development may not be smooth or synaptogenesis may not be there. Whereas HMOs also play important in synaptogenesis. Now in HMOs, Thus, their role in brain development is much less compared to that in gut. But since we know gut-brain axis, GBA is a very well-known connection between the gut and the brain. So if your gut is healthy, your brain will be in a good shape. So their role in brain development is less compared to their massive role in gut management. So these, I have taken the crux of all the different studies and I've summarized in the key evidences. So these were all the different studies which have been done on the effect of HMO on brain and development. So what they found, that they help in cognitive improvement, they help in learning, they help in improved learning behavior, and they help in also improving the better digestive system of our body. So these were the studies which have been found to be very much effective on the parts of brain and in intestines. And another important thing, to give you a recommendation by the standard authorities. This is ESFA and FDA statement on inulin, FOS, and GOS in 2020 and 2019. Sorry, what they told. EFSA stand for European Food Safety Authority, and FDA, we know that food administration. So they did various clinical studies, some of which I have shown you in the presentation today. And what they found, that there is no scientific conclusion can be drawn regarding the effect of GOS, FOS, and inulin or reduction of potentially pathogenic bacteria in intestine. So in the absence of convincing evidence of any beneficial effects of these non-digestible oligosaccharides like inulin, GOS, and FOS, they told that it is not necessarily to add these GOS, FOS, and inulin as a prebiotic in nutrient foods or in any other, infant foods or child foods or nutrition, because they don't found to be effective in increasing the growth of selectively good bacteria. So nowadays, if you go and see the different products of formula feeds, whether it can be XYZ, I don't want to name them, but if you check them, it will be mentioned nowadays that they have been provided with a prebiotic like GOS and FOS. None of them is mentioning they have been provided with the HMOs, because it's very difficult to extract HMOs, and from human milk it's not possible. We have to extract from the bovine milk. So they are mentioning that they are containing GOS and FOS, improving the growth of good bacteria, but they never mention that it is also increasing the growth of bad bacteria. So that is the main difference between an HMO and inulin, FOS, and GOS. So overview of these HMOs, overview improvement is they promote the growth of beneficial bacteria like bifidobacteria, help in pathogen, help in modulating the immune system, and to a bit help in improvement of the brain and development. So which is a wise option? Should we use prebiotics, FOS, GOS, inulin, or HMO alone? Should we use probiotics alone, or should we use prebiotics and probiotics in combination, what is called as symbiotics? So let's see. One thing is very sure, that probiotics have to be used, because the gut dysbiosis, we need to figure that we need to provide them with good bacterial strains. Now, there is no such thing that it would be an overdose of a good bacteria, nothing like that. We need to provide with a good bacteria. So probiotics is very much required. But along with that, because we have those issues, and the problem is when we give a probiotic, multi-strain probiotic, it will be containing inulin, GOS, and FOS. So as a result, in order to compensate for that, the best would be is that if we give a trial of a probiotics containing good bacterial strains of bifidobacteria along with a prebiotic containing HMO. Because if we give FOS, GOS, and inulin separately, then we know that the problems can happen. And the problems are more with inulin compared to FOS and GOS. So the best option would be giving a symbiotic in combination with an HMO and a probiotic containing different strains. So how these, so symbiotic is what? Symbiotic basically means a combination of a prebiotic and a probiotic. But the important thing is what type of prebiotic you are giving and what type of probiotic you are giving, in what dosage and in what strain. This is the most important thing we should remember, because in markets you are having ample number of probiotics. You know about prebiotics like GOS, FOS, and inulin. But what type of prebiotic and what type of probiotic has to be given, taking into consideration the type of strains and the quantity, that is for how much quantity you should give, in what colony forming units you need to give. So these now I don't want to go into the details of this symbiotic mechanism. The basic purpose is when you give a prebiotic, and then you give a probiotic, so that prebiotic should increase the growth of that probiotic which you are administering or which you are giving. So that is what we call as a synergistic symbiotic. Means you are giving a probiotic, and along with that, you are giving a prebiotic. So this prebiotic is specifically increasing the growth of the probiotic which you are administering. So the best example would be, I am giving a probiotic containing different strains of bifidobacteria, and I give an HMO as a prebiotic. So it will specifically increase the growth of bifidobacteria only. So this is a classical example of synergistic symbiotics. So this is the best option that we can go in managing the children who are on the spectrum. So which one to choose? Prebiotics, inulin, phosgos, or HMO alone, or a probiotics containing bifidobacterium strains, or a symbiotics containing probiotics plus prebiotics like inulin, phosgos, or a symbiotics like probiotics plus prebiotics. So symbiotics containing probiotics with different strains of bifidobacteria and a prebiotic with HMO would be a very wise and a good option. Now the problem is commercially available. Are these HMOs commercially available? Till recently, no HMOs were commercially available. As I've told you, they are present naturally in the human milk, so it's not possible to extract them. But now, because for the advancement on biotechnology on large scale production, and because of the difference, enzymatic processes and advancement in these biotechnologies, they have now been extracted from the bovine milk, that is the cow milk. So although they are present in the problem is they are present in very less quantity. So through these enzymatic processes and biotechnology processes, they have extracted only the HMOs from the bovine milk, and they have increased them in number in quantities. Now, how they have increased, that is beyond our topic or discussion, but because of these advancements, they have increased. And one thing is also good, they are casein free, they are gluten free and lactose free, because they have extracted only the oligosaccharide or the prebiotic component of the human milk or the bovine milk. And another important thing, that regulatory approval has now been given by FDA, that is Food Drug Administration, for only 2FL and LNT, because others there are more than 150 different types of HMOs, but only 2FL and LNT have found to be shown beneficial effects on the gut, on the brain, and in various clinical trials. So they have been given a GRAS, means generally regarded as safe, and have been given a regulatory approval to be used commercially. But unfortunately, none of these two is available in India presently. So conclusion is, they are available but not in India. They are available in US. So the conclusion is, HMOs are unique prebiotics in modulating the gut microbiota and helping in improving the immunity. HMO plays an important role in brain development. Unlike inulin, phos, and gauze, HMOs do not promote the growth of non-beneficial bacteria. They selectively increase the growth of bifidobacterium strains of beneficial bacteria. So whereas inulin, gauze, and phos, they promote the growth of both bad and good bacteria. So that's the difference between the two. So to a take-home message, we know that gut dysbiosis is an alteration of GBA, which has been, without doubt, has been associated with ASD. So gut dysbiosis, we know that there is a decrease in bifidobacterium strains. So various studies have also shown that there is a decrease in bifidobacterial strains in gut microbiota of ASD kids using RNA sequencing techniques. So a best combination would be using a probiotic containing different strains of bifidobacteria with a prebiotic containing HMO could be a great, innovative, safe, and rational approach in managing ASD kids. So this is about all the today's webinar. And so a best combination would be using a probiotic with HMO. But the problem is, in market or even globally, there is no different strains of probiotics of bifidobacteria in combination with a prebiotic like HMO, though they are present in combination with inulin or gauze and phos, but they're not present with HMO. So the best thing would be to use a probiotic with different strains and a prebiotic like HMO separately. So this is a prebiotic which have been given the approval, and also the most important thing is that it is containing 2FL and LNT. And another important thing, they have to be present in ratio of 1:4. In the studies and also in the literature, it is clear, it has been mentioned that the ratio of these two, 2LNT and 2FL, that is lacto and nuclease, and 2FL and this LNT should be in the ratio of 2:4. So that is what exactly it is present, and it is also free from gluten, and it is containing these 2FL components, which can be very, very useful if we give along with the probiotic of different strains of bifidobacterium, as I mentioned. And so the best thing would be, if we do not give these prebiotics on regular basis, at least we should give them, a probiotic should be given on regular basis, and a prebiotic like this, pure HMO is there, can be given at least on alternate days or once a day, so that they keep on giving a feeding material for the good bacteria to grow in number. And we have started using this product in some of our patients, and we hope to get very good results in our kids. And at least, although we know that we cannot purely cure them, but at least we could help in improving the symptoms, and we can get a good positive results from children who are being using this prebiotic along with these probiotics. So this was all about today's webinar about prebiotics versus probiotics and their importance and the role of these HMOs and how unique it is in comparison to other prebiotics which are easily available and known like inulin, gauze, and phos. So thank you very much, parents. Thank you very much for attending today's webinar. Take care. Good night. Have a great day. Thank you.